Many of you will recall that in August, after months of negotiations, 25,000 members represented in the healthcare sector at regional health authorities in most areas of the province overwhelmingly voted down the employer's best offer and gave the bargaining committees a strike mandate. Since that time, CUPE and MGEU teams have been working with the employers to resolve issues at the bargaining table. But the process has not resulted in a meaningful improvement to offers to our members. That's why today, both unions here are announcing strike notice. We are unable to reach a fair deal at the bargaining table within the next 14 days, which is the mandatory number of days necessary to provide strike notice. Strike action will begin on October 8th. This is plenty of time to get a deal done if we see a fair deal offered at the bargaining table. A strike is always the last resort, but healthcare is in a staffing crisis, and this crisis demands urgent action. We know that without a fair contract that will help in recruiting and retaining dedicated healthcare workers, Manitoba's healthcare system will continue to struggle with the critical staffing shortages. Staffing shortages are not just a problem for workers who see their workloads increase. Those issues make their way to the bedside and affect the care that patients receive.
Healthcare jobs are once seen as highly desirable in Manitoba communities, but it's hard to recruit when the starting wage is $17.07 an hour. Workers can find jobs at Tim's, McDonald's, or the deli counter at Co-op for far more money and work that is physically and mentally less demanding. Anyone who works in healthcare knows it takes a whole team to deliver quality care. But healthcare support workers are being left behind. With the lowest pay in Canada, they deserve better. Meanwhile, other healthcare providers like doctors, nurses, have seen generous pay benefits at their negotiating tables. We're not asking for what they receive, we're asking to close the ever-widening pay gap that has developed between these professions and support staff. We're asking for healthcare support workers to get the same kind of consideration and respect for their contributions to the healthcare system. To date, the solution has been kick the can down the road. Fill service gaps with costly private agency staff, but we know everyone loses if we keep going down that road. Relying on agency staff is not good for local economies, it's not good for healthcare workers, and most importantly, it's not good for patients and residents.
I'm Margaret Schroeder, President of CUPE 204, representing Shared Health and the WRHA. I'm joined here with Holly Chaperone, President of CUPE 4270, representing Southern Health, and we are both frontline healthcare workers. We're also joined by Gord Delbridge, President of Local 500, representing Riverview Health Centre. Every day that employers put off addressing the issues, that patients in resident care will continue to suffer. We're asking the employer for a contract that makes healthcare jobs competitive and helps grow the workforce needed for care for Manitoba patients.
So the message from all unions to the employer is clear. Prioritize care, prioritize these workers, and prioritize coming back to the table with an offer that we can take back to our members.
Our message to all healthcare workers is clear. We've heard you loud and clear. We stand with you to fight for what's fair. We've got your back.
Our message to the NDP government is also clear. Promises have been made to fix the healthcare system. There is no healthcare system without people who provide healthcare. Addressing the staffing crisis must be job one and can't happen if these workers are not being recognized appropriately for their contributions. Our message to Manitobans: this is not what our members want to be doing. They're in the business of caring, not picketing. A strike is a last resort when all else has failed. Well, all else has failed. We know this will cause disruptions to healthcare services. We will continue to provide essential services. But this is about the future of healthcare, the future of public healthcare. And we think that's worth fighting for. And all these members here think it's worth fighting for. Thank you.
So just again, if you have questions, please direct them to either one of the leaders or to both.
I guess for, go with yourself, what would a strike look like? I guess you just mentioned that essential services would continue on.
Well, it means reduced services. It means that patients will be served with plastic cutlery, plastic plates. It just means they won't be, Manitobans won't be getting the service they expect to receive from the healthcare system. The essential service will be there, life and limb will be preserved, but overall you won't have the other parts of the healthcare.
Maybe same question for Jim. What would a strike look like in terms of, what's essential, what's not essential?
Yeah, what it'll mean is that we're all fighting first and foremost for fair wages and better working conditions. That's the goal. That's at the core of it. What that'll look like across the province, we're covered by essential services agreements and the language, of course. We've got hundreds of members signed up as strike captains right now. So training is happening. There's shift signups. Everything is happening. So we're in the process of moving forward. What that will look like will be dictated by the days to follow. But right now we're committed to working towards a fair contract.
So since both members or both unions voted against this contract, there has been some negotiations. What have you guys proposed? Like, I know there's a certain salary percentage increase. Are you proposing to go higher than that? What have you guys put forward?
Yeah. Shannon, do you want to come?
Yeah, hi, sorry,
come
I'm
right
Shannon
up.
McAteer.
Can I get you in front of the
Yeah,
mic?
come
sure.
right up. Come right up.
Yeah.
Yourself first.
Sorry, I'm Shannon McAteer. I'm the healthcare coordinator for CUPE. So we don't bargain in the media, so we're not going to talk about what is actually on the table. What we can say is we have table proposals that is more. We heard loud and clear from the members that they want more. There's a staffing crisis in healthcare right now, and the way to fix that is to support the staff that you have. We need to recruit and retain staff, and you need to do that by providing better wages, by providing better working conditions. So we're waiting for the employer to come back to us, and I'll let MGU speak to what their proposal parts are.
Does the more include money? More
Yes.
Actually, Shannon, I'll go back to you. Do you regret endorsing the previous offer? Just if you regret.
No, we don't regret endorsing the previous offer. We said all along that we wanted the members to choose. It was a fair and reasonable deal, but we heard loud and clear that the members want better working conditions, they want better wages, they want to be respected by their employer and the government. So we said whatever the members chose, that's what we would do, and that's what we're here for.
I know you touched on this already, but we heard plastic cups, plastic cutlery. I'm wondering if you could expand even a little more on what a strike would actually look like, right? Like, essential care still has to be served, but I'm wondering if you could expand a little more even on the quality change. This could be for Gina or anyone.
Cal, you want to?
I think there'll be many challenges for our workers who want to provide this service during a strike. It may look like less baths for residents and patients. There's many different things. It's really difficult to really say what it'll look like. I don't think we've seen a healthcare strike in a long time. It's unfortunate we have to come to this point. I think it's really important that we get to the table and bargain a fair deal, right, in the next 2 weeks. Our goal all along was to bargain a fair deal that all these members here would accept. And we've been trying to do that all along, and unfortunately, we're not seeing that at the bargaining table. We've tabled our last offer on September 5th, and we're waiting for a reply from the employer. It's already, the 23rd, 24th? It's been a while. We're just trying to move this along so we can get to a place where our members get a deal they can vote on and accept or reject. It's really up on the members control this thing and control when we bargain, and we're really just looking for a place where our members feel they've been respected at the table.
So just to clarify, on MGEU's front, you guys last put in an offer on September 5th?
I believe both of us
Yes, correct.
have put in an offer September 5th, but a response to the employer
Okay. Sorry, you haven't had a response to that offer?
since the 5th, correct.
Sorry, was the offer in the 5th?
We responded to the employer with an offer on the 5th, and they were intending to come back, and we have yet to meet on those.
That's the same thing?
Yes, correct.
Same offer the same day?
CUPE and MGEU are working The microphone, sorry.
No worries.
We're working very closely together because we represent the same membership. We represent the support sector in Manitoba. So yes, we both tabled proposals on September the 5th, and neither one of us have heard back from the employer in terms of responding to that proposal package.
Has that been the only offer proposed since both of your unions voted against the deal?
Correct. And maybe I could just expand for a minute on the essential services piece. These healthcare workers, like 25,000 healthcare workers, are committed to their jobs, they're committed to their residents, their patients, their clients, or they wouldn't do this. They're certainly not doing it for the money. They are very committed. And when it comes to essential services, we are required by law to provide essential service. It will look very different, but we're going to do everything to make sure that the patients, the clients, the residents, they're not suffering because the CUPE and MGEU are on strike. But care will be provided, but it's going to look different, as Kyle had said. So I just wanted to clarify that I've negotiated all of the essential services agreements, so we are ready. We're in a strike position.
MGEU has cited 1707 as a starting wage for, I guess, their members and other two RHAs. For you, Shannon, like, is that the same for your members in Winnipeg and elsewhere?
Yes, we have standardized wages between the two groups, so yes, our wages are the same.
You mentioned the two of you guys are working closely together. Why make that determination now rather than earlier?
We were working together prior. Our bargaining committees had different philosophies, I guess, when it came to recommending the deal or not recommending the deal. But we were working together for this whole round of bargaining.
Is it possible to just have like a brief description? I know there's some things that you cannot tell us, but what does it look like for you to have better working conditions? What does that mean exactly?
The biggest one would be more staff. There's been a staffing crisis. Both unions have been talking about that for like 10 years, not just since COVID, which is where it kind of became a light was shone on the staffing crisis in healthcare. So that's where it needs to start. It needs to start with recruiting and retaining the staff that we have, which is going to involve better benefits, better wages, better working conditions, which means not working short all the time. All these folks up here can tell you this is the norm to be working short because there are not enough staff, and that's province-wide.
How soon do you expect to achieve an agreement that will be suitable for you guys?
We can't put a time frame on it. We're still waiting for the employer to respond to us, and we're hoping today will spark something.
Would be
as soon as possible, of course. Of course, we would like to get these folks to have better wages and working conditions as soon as we possibly can.
And as part of your agreement, when you were proposing the agreement, did you look Canada-wide on what other healthcare workers were getting? As you know, in the release, you're saying that here that we're the lowest paid healthcare workers in Canada. So did you reference some other cities or provinces in terms of what they're getting?
You go ahead, Kyle.
Can you say the question again, please?
When you were looking to settle an agreement, you're saying that Manitoba is the lowest paid healthcare workers. Did you reference other provinces to see what they're getting in terms of what settlement you wanted?
I'd say we're looking for a deal that these workers can accept and it solves the crisis in healthcare. We have workplaces with 80% vacancy rates in Prairie Mountain. So there's a real issue here, and the quality of care is going down. Agency work is taking over. It's privatizing our healthcare system. So when we look across the country, of course, we looked and did our research, and sure enough, we were dead last in the country, and I think we're seeing the results of that in this province, with vacancy rates at 50% in probably half the province rurally. I don't know what it's like, and I can't speak for CUPE in the city. So that we're really looking to make our public system a true public system, and remove this agency, make agency the exception, not the norm. In many places right now, agency workers are providing this work at a higher cost to Manitobans, where we could hire people locally to do that work.
Kyle, when MNU members voted for a new contract, shared health nurses were the ones who said no, and they tried to bargain for more money, but they were told it was a mandate, and that the only benefits they could get beyond that were non-monetary. That's what happened when they sort of said no to a contract offer. You guys are now in that position. do you have of worries that the employer in this case will not come forward with monetary increases and just non-monetary ones?
I think we're open to bargaining at the table. We're willing to work with the employers to try to find a deal that's fair for everyone. I think our members have said loud and clear they think our deal should be more. And let's be clear, they haven't offered us what they've offered the nurses. The nurses have been offered more. And we're asking for something that's fair for our workers. We're not asking to be number one in one round of bargaining, and we're not asking even to be number one. We're just asking to be treated fairly, where people want these jobs, these jobs were the cornerstone of a lot of communities. And now people aren't taking these jobs. They're choosing to work other places. Healthcare really needs to be an employer of choice, or actually have people who want to do that work, and we're not seeing that now because they're just not competitive in the market.
For either Shannon or Gina, some complaints from CUPE members on social media. One of them that I'm sure you're aware of is about the union dues. They say there's a proposal that it will increase by 3.75%. That might be temporary, but can you explain why you want to increase union dues?
Actually, that's an internal CUPE process, and all I say is that would be a temporary, and it's connected to the strike pay. But other than that, we're not going to comment on the due structure.
Why do you want to increase dues during this time period?
Well, that will be explained to the members at our general membership meeting, so we'll explain it to them. We're not putting that out on Facebook.
But I guess they put it out on
Yep.
Facebook, so I guess that's why I'm asking about
Yeah,
it. Why-
and that's fair, but we're not going to comment about our internal CUPE processes publicly.
There's a proposal as well to sell the building that you guys are in for $650,000, or at least that's what it's appraised at, and buy a new building for $1.7 million, doubling the cost. Some complaints about that, being a waste of money. How do you respond?
Correct. The space that's for CUPE Local 204 specifically, and the space that they are in is not small. It's not small enough. It's not big enough for the local. And this has all gone through the correct process, again, at the general membership meeting. So we can't get too much into that except to say that it's following the correct process, and the members will vote on that ultimately.
Just a quick question, just to reiterate for either Shannon, Gina, or Kyle, just for healthcare workers listening into the news later today, what do you hope resonates with them the most about today's announcement from both CUPE and MGEU?
Sure. So a message for all workers through the province, every classification, every sector of work. We're here to bargain. You've got a strong team, both teams coming together to bargain. We're ready and willing to negotiate these contracts together. We are here to ensure fair wages, better working conditions. We have heard from members day in and day out through the pandemic to present day that you're working short, that the impacts are so heavy. We hear it. We hear about mileage. We hear about all the impacts in every way. And we're here to say that we're holding strong. We've got a great team here. We're working together to ensure that healthcare workers are protected through this contract and that we're all in for them. Do you want to add anything?
How much to add on that?
Okay.
Maybe the fact that you two unions are collaborating on this, I know there's been a lot of changes with union structures and all that. How common is this? How rare is this?
I would say it's pretty common. We just seen it happen in Nova Scotia with our sister union in Nova Scotia, and SGU is working with CUPE and other healthcare unions to bargain. They bargain at a central table, actually. So I think it's better for all workers when we stand all together, where we do the same work. There's no reason that we should be at separate tables. In my opinion, we should be at the same table working for all our workers together. We have the same issues in many of our places. I think we're a stronger unit when we stand together.
I can add something too. And solidarity is the core of our movement, right? Coming together at the times when we need it most is absolutely crucial. 25,000 healthcare workers is a substantial number. We haven't seen these numbers since 1919, right? So coming together as solidarity at the core of us working together is important. It's important for healthcare workers to stay connected to their local, get in touch, sign up to be a strike captain. We're here with training, we're here and ready and prepared, and that's the core of it is solidarity. So we will see a strong movement over these next 2 weeks to achieve that fair deal, and we're in it together.